Hi, I'm Holger. I'm going to show you how to do a secondary full assessment of a person, especially when you are going to be responsible for a victim for an extended period of time, like maybe even overnight. You definitely want to make sure you found everything that's wrong with that person. Now, if that person is conscious, they'll be able to help you a lot. But if they're not conscious, then it's going to be up to you to find all of the things that you need to be aware of. One of the mnemonics that we use during this assessment is called DOTS. You're looking for deformities, open injuries, tenderness, and swelling. And even an unconscious person might react if you touch something that's tender, and you certainly should be able to tell if something is swollen. So the entire point of this exercise is to make it all very methodical. You want to go from the head, down the body, down the legs, and then do the arms last. You want to make sure you don't miss anything. This doesn't have to take very long, but you should be very thorough in doing that. As you notice, I put my gloves on, and if at all possible, you do want to put your gloves on, because one of the things that you're looking for in this patient is to see if there's any bleeding that you haven't found yet. About clothing removal. At this stage of training, you don't need to remove clothing beyond the heavy clothing that's on the outside, jackets and so forth that you can get off. But if you do see torn clothing, any penetrations, anything obvious, then you just might have to lift the clothing and have a look to see what's going on underneath there. Because if there is bleeding and they're wearing heavier clothing like sweatshirts and so forth, that's going to absorb some of that bleeding, and you may not know that until you look at the skin of the actual injury. So when we do this assessment, again, we'll start at the very top. We're going to start with the scalp and check everything, make sure that there are no bumps, no bruises, anything that you can feel. Reach all the way down the neck, feel the neck to see if there's anything, then pull your hands out to see if there's any bleeding. Then we check the facial bones all the way around, make sure that they're all in one piece. Check the jaw, make sure it's all done. Check the nose. We actually look in the nose. Then we look in each ear, each side, to make sure there are no fluids coming out of there, because that's a very, very bad thing if that were to happen. We might also open the mouth to make sure that there's no damage in there. About dentures, don't take out any dentures that are in place. If they have moved, however, or are loose, then you might need to remove them so the patient doesn't choke on them. Next, look at the neck. Make sure that the trachea is in the middle. If the trachea is moved to one side or the other, that will indicate that there's a problem with the lungs. Next thing we want to check is the clavicles, the shoulders. Make sure they're equal. You can check them both. Check the clavicles. No deformities. That's great. The next thing is we want to check the sternum and make sure there are no broken ribs. And we do this by using the edge of the hand, and we roll the edge of the hand straight down right to the xiphoid, that little triangular bone there. A little bit of pressure. If you feel any crunching or crackling, then you know there's a problem. Next is checking the rib cage. The rib cage, as you see, goes all the way to here. So what we want to do is a twofold check. One, to see if we feel any broken ribs. Number two, feel if the patient is breathing equally. Now, being a girl and me being a guy, I'm going to turn my hands around so my thumbs are facing away and downward. Then I put my hands on each side of the rib cage and squeeze lightly and wait for just a few seconds to see how my patient is breathing. I can bring him up a little bit and make sure there are no broken bones there. And she seems to be breathing very well. I move on to the abdomen. In the book and some of the demonstrations, they show you poking. You have no business poking at anybody's abdomen. You have no idea what you're poking at. But what we are interested in is that everything is nice and soft and squishy. Because if there were any injury here from blunt trauma or any other, then you would feel a very hard lump in the area where the person is injured. So what we need you to do is literally roll your hand across the person's abdomen, just literally squishing it back and forth in 4 movements: upper right, upper left, lower right, lower left. Also watch the person's face to see if they may be squirming because something actually did hurt. Next, we want to reach behind the person, underneath, as far as we can go. Again, dig our hands in there without moving them, and then pull our hands out to make sure there isn't any blood down there. Next, we move on to the hips. You can find the person's hips, find the front of the hip bone and the top of it. Never, 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 ever push down on the person's hips to check them. Always only push in from each side. Watch their face to see if there's any reaction, and to see if you feel anything moving when you do that, or hear anything moving. On older patients, or if you think there may be something strange going on with the tops of their thighs, move down a little bit and make sure that the thighs are still engaged in the hips in the right place. Next, we're going to move down to the legs. Being an extremity, it goes all the way around, and we want to make sure we use the surface of our whole hand to check the extremity, not just the fingers, because if we just do this, we're only checking what's under our fingertips. We want to use the whole hand. And so we want to wrap our hand all the way around, make sure that we feel that there's no protrusions, no deformities, no swelling. Pull your hands out, no blood, good. Check the knee, make sure the kneecap's in the right place. Come all the way down. Check all the way down, check the ankle, make sure the ankle is not swollen. Again, no blood. When you get to the feet, if your patient is unconscious, you're not going to be able to tell much. Sometimes when you run your fingers up the bottom of their feet, they may react. In a conscious person, you would ask, can you wiggle your toes? Or can you feel me squeeze your toes? Just to make sure that they have neurological and circulatory function in both legs. Then we would do the other side as well. I'll skip that for now. And only then do we come back up to the arms, where we're going to do the same thing. And again, start at the top of the arm, all the way down to the elbow. Check, make sure there's nothing wrong. Check there's no bleeding. Check the lower part of the arm. Does the hand work? Now, if the patient is unconscious, they won't be able to squeeze your hand. If they are conscious, ask them to squeeze your hand. And if you're worried about head injuries, have them squeeze both of your hands at the same time. One way to check for circulation in a unconscious person is to squeeze their fingernail. See how it gets white and then turns red again? We call that capillary refill. And that should take about a second, at the most a second and a half in older people. So apparently so far so good. My patient is doing very well. One thing we haven't checked yet though is the most important part of this patient, which is really their spine. And that's very, very difficult to do when you're by yourself. But I will show you how that's done. We're going to need to move the near arm as straight above the person's head as possible. Always try to move it that way and not rotate it around the side to avoid dislocating their arm. Then we're going to take the far arm and put it over their chest just so it doesn't get in the way. Then I'm going to take the far leg and move it over the near leg. And then the whole point is to roll this person up against your thighs so that they're laying on their side. So with one hand I will grasp them by the hip, the other one I will take and scoop their head up so that I move and roll them up against my thighs. So see how she's resting there now with her head on her arm, which keeps the spine in a relatively straight line. And then I can take 2 fingers, one on each side of the spine, and check all the way down the spine and make sure that everything is good and in place. There are no bumps, there are no scrapes, there's nothing sticking out, nothing going sideways, and good.